The workload that doctors, nurses, and personal support workers are facing at this point is higher than it's ever been. But they're not the only healthcare workers fighting COVID-19 on the front lines every day. Paramedics are also facing an overwhelming number of medical calls, and as a result, that effort is taking its toll.
It is stressful, it is demoralizing. We are completely burnt out and beaten down.
Non-stop calls to go and help someone experiencing COVID symptoms on top of the vital medical emergencies paramedics would normally see.
We're coming into work every day knowing that overtime's been called out, that we're short-staffed, that call volumes are critical.
This Toronto paramedic, his identity hidden to protect him from any consequences for speaking up, says he chose this line of work to help people and knows just how important it is. But no washroom breaks, meals while sitting on the bumper of an ambulance, continually sanitizing vehicles, and constantly changing PPE all add up.
You could be out there for, easily 14 hours. And this is, it's continuous, it's daily now. There weren't enough staff prior to COVID, and they've added no additional paramedics during COVID.
The city says there are about 1,100 full-time medics at this point and about 250 part-time, now taking on more responsibility. 166 were hired last year to cover attrition. What can be done to offer city employees, like paramedics and our fire personnel, some relief, if anything?
Our emergency responders have absorbed a significant burden over the course of COVID is accurate. But I will also say it is equally accurate that our entire City of Toronto staff team have absorbed similar.
We've really tried to enhance our level of support on the mental health side for staff with various access points that really helps connect our staff with our team to make sure that they understand what they need to do.
While frontline medics are feeling overwhelmed, Toronto Paramedic Services says the number of emergency calls in 2020 was the lowest it's been in 4 years. Data provided to City News shows there was more than 307,000 calls compared to 2016, when it was below 300,000. And yet, the impact and stress of COVID is greater than ever before.
I'm still hesitant to go home and hug my new wife. After a day where we've seen lots of COVID patients, sometimes I won't even come upstairs. I'll go hang out in my basement.
The union also points to a recent outbreak in the ambulance dispatch center as another example for why more needs to be done. 11 staff members are in quarantine, another 24 are in isolation. Both Chiefs Pegg and McEllister say service levels haven't been affected.